and open. And bite together. There we go. Okay, go ahead and open again. Okay. Go ahead and bite together. There you go. Together. There we go. One more. Okay, go ahead and bite together. Looks good.
Hello, Miss Lauren. How are you?
Good.
I'm Dr. Eberlein. We're here to take good care of you today. And we got some digital x-rays of your teeth, of your back teeth. And what we want to do is we want to look at your x-rays here and see if there's any indications that you may have cavities starting in between your teeth. Now, typically, people that get cavities in between their teeth is people that tend not to floss. Now, I always talk about flossing. Well, the analogy I always use about cleaning your teeth is kind of like washing your car. So, if you brush your teeth and never floss, well, it's kind of like when you clean your car, you clean the hood, the roof, and the trunk, but you never clean the doors. How would your car look like after a while? Dirty. Well, flossing is the same way. If you just use a toothbrush all the time, you're cleaning that hood, roof, and the trunk, but you're never doing the doors unless you floss. And so that's why a lot of people will tend to get cavities in between their teeth, but when they smile, they don't see anything. Everything looks healthy, looks nice, but that's because they just can't see the cavity. So this is what x-rays do for us, is it shows us where you have cavities. And I'm going to show you an example of a cavity on an x-ray that we see. This is your upper left area. Pull this out here. There we go. And what we look at is little shadowings like this. This is a shadow, and I can even do this right here and it will kind of highlight that spot for me. I can also change the contrast of it to a lighter or a darker. And you can see the area a little more clear on the x-ray. Now, over here is a normal tooth that looks healthy. The enamel's all there. This is the dentin, and that's the nerve of the tooth right in the middle. So that's healthy. So now when you look at this tooth and you look at this area here, can you see a difference? Can you see that little shadowy area like that? Well, that's an indication of a cavity starting right there in between the teeth. It goes this way and that way. Now the good news is that it's not very big. A lot of times when people get big cavities, they go all the way to this dark area in the middle of the tooth, which is the nerve, and then that's when people start having sensitivity. Like if you're going, wow, my tooth is hurting to sugar, and it hurts to when I drink cold things, or sometimes it just kind of aches. Well, that's an indication that that cavity is getting close to the nerve. But that's not you, so that's the good news. You feel good about that? I figured so. So that is on your upper left that we can see that you have a cavity right there. Let's put this back in here. Oh, we gotta go with that first. Alright. Now when I look at the upper right, you have the beginnings of a cavity, what they call an incipient lesion, meaning that it's not quite a cavity that goes through the enamel. It's not cavitated, meaning there's no hole, but there's signs that the enamel is demineralizing, which means that it could turn into a cavity. So if you find that you're not a flosser, well, if you do some fluoride treatments and start flossing, then all of a sudden you may be able to prevent that from getting worse, and then you don't have to get any fillings done. And so what I'm going to do is take a look in your mouth and see if what we see on your x-rays is the same as what we see in your mouth. Okay. So if you're 14, are you going in that 9th or 8th? 9th. Oh, just like my son. Okay. So what we're going to do is I'm going to take a look at all your teeth. I'm going to look at your gums. I look at your cheeks. Look underneath your tongue. What I like to do sometimes is you want to check the sides of your tongue. Let's see, stick your tongue out at me like you mean it. There you go. And I'll just pull that to the side like that. And we just look for discolorations, ulcerations, raised type of lesions, maybe spots that just don't look healthy. And that all looks normal. I like to just check around the teeth and check around the gums. And you have a nice smile. You have pretty teeth. You have pretty nice straight teeth. Did you have braces or no? No? So you're one of those people that's really blessed with really nice straight teeth. You have a couple that are slightly rotated, but does that bother you? Would you ever want to straighten those out, or are you pretty comfortable with the way they look?
If I had a chance, so I'd straighten them out.
You'd straighten them out if you could? Well, the good news is with your teeth, because most of them are really pretty straight, you can straighten them out without doing those brackets and bands. You can do what they call clear aligners. Clear aligners are like little retainers that are clear. And you can move your teeth right into position, and you probably could do it in a matter of months rather than a year or two. How does that sound?
Sounds good.
Yeah. Now, if you wanted to change what they call an overbite or show more teeth when you smile, then you have to do brackets and bands. But if you want to just straighten a couple of the front teeth out, you don't have to do that. You just check your gums. Now, this may be a little tender, especially if you haven't had cleanings in a while. You can see there's a couple spots that show that it starts to bleed a little bit. That tends to indicate gingivitis. So the same thing that causes cavities can cause gingivitis. And if you don't control that, then that will turn into what they call periodontitis, which is a gum disease. Now, you don't have that. But the whole point, though, is that we don't ever want you to have something like that. So that's why any area that you have a little bit of bleeding around your gums tells me, and it tells you, that you probably have to do a little bit of better home care. Okay? Okay, so in your situation, you have wonderful teeth. Your gums are a little red. They bleed a little bit when I probe around there, so you need a cleaning, but it's easily reversible. And you have a couple spots, 2 teeth in particular, that need fillings, okay, in between the teeth. So if we fix those for you and get your teeth cleaned, you'll be back to square one. You'll be doing good. Okay? There we are.